Hi everyone, today in this video I will talk about thrombocytopenia in detail. Well, thrombocytopenia is a condition in which you have a low blood platelet count. Platelets, I mean thrombocytes, are colorless blood cells that help blood clot. Platelets stop bleeding by clumping and forming plugs in blood vessel injuries. Thrombocytopenia might occur as a result of a bone marrow disorder such as leukemia or an immune system problem, or it can be a side effect of taking certain medications. It affects both children and adults. Thrombocytopenia can be mild and cause few signs or symptoms. In rare cases, the number of platelets can be so low that dangerous internal bleeding occurs. Treatment options are available. Well, first of all, let me tell you the symptoms. Thrombocytopenia signs and symptoms may include easy or excessive bruising, that is purpura, superficial bleeding into the skin that appears as a rash of pinpoint-sized reddish purple spots, and these are known as petechiae, usually on the lower legs. Prolonged bleeding from cuts, bleeding from your gums or nose, blood and urine or stools, unusually heavy menstrual flows, fatigue, enlarged spleen. You should make an appointment with your doctor if you have signs of thrombocytopenia that worry you. Bleeding that won't stop is a medical emergency. Seek immediate help for bleeding that cannot be controlled by the usual first aid techniques such as applying pressure to the area. Now I will tell you the causes. Thrombocytopenia means you have fewer than 150,000 platelets per microliter of circulating blood. Because each platelet lives only for only about 10 days, your body normally renews your platelet supply continually by producing new platelets in your bone marrow. Thrombocytopenia rarely is inherited, or it can be caused by a number of medications or conditions. Whatever the cause, the circulating platelets are reduced by one or more of the three processes which I am going to tell you. These three processes are trapping of platelets in the spleen, decreased platelet production, or increased destruction of platelets. First, I will tell you about trapped platelets. The spleen is a small organ about the size of your fist situated just below your ribcage on the left side of your abdomen. Normally, your spleen works to fight infection and filter unwanted material from your blood. An enlarged spleen, which can be caused by a number of disorders, can harbor too many platelets, which decreases the number of platelets in circulation. The second one is decreased production of platelets. Platelets are produced in your bone marrow. Factors that can decrease platelet production include leukemia and other cancers, some types of anemia, viral infections such as hepatitis C or HIV, chemotherapy drugs and radiation therapy, heavy alcohol consumption. The third factor is increased breakdown of platelets. Some condition can cause your body to use up or destroy platelets faster than they are produced, leading to a shortage of platelets in your bloodstream. Examples of such condition include pregnancy. Thrombocytopenia caused by pregnancy is usually mild and improves soon after childbirth. Another condition is immune thrombocytopenia. Well, autoimmune diseases such as lupus and rheumatoid arthritis cause this type. The body's immune system mistakenly attacks and destroys platelets. If the exact cause of this condition is not known, it is called idiopathic thrombocytopenic purpura. This type more often affects children. Bacteria in the blood. Several bacterial infections involving the blood, that is known as bacteremia, can destroy platelets. Thrombotic thrombocytopenic purpura. This is a rare condition that occurs when small blood clots suddenly form throughout your body, using up large number of platelets. Another condition is hemolytic uremic syndrome. This rare disorder causes a sharp drop in platelets, destruction of red blood cells, and impairs kidney function. Medications. Certain medication can reduce the number of platelets in your blood. Sometimes a drug confuses the immune system and causes it to destroy platelets. Examples include heparin, quinine, sulfur-containing antibiotics, and anticonvulsants. Now I'll tell you the complications. Dangerous internal bleeding can occur when your platelet count falls below 10,000 platelets per microliter. Though rare, severe thrombocytopenia can cause bleeding into the brain, which can be fatal. Now I will tell you about the diagnosis of thrombocytopenia. There are certain factors that can be used to determine whether you have thrombocytopenia. The first, we usually advise blood test. A complete blood count determines the number of blood cells, including platelets, in a sample of your blood. Physical exam, including a complete medical history. We usually look for signs of bleeding under your skin and feel your abdomen to see if your spleen is enlarged. Um, we may also ask you about illnesses you have had and the types of medication and supplements you have recently taken. Also, your doctor might suggest other tests and procedure to determine the cause of your condition depending on your signs and symptoms. Now I will tell you about the treatment. Thrombocytopenia can last for days or years. People with mild thrombocytopenia might not need treatment, but people who do need treatment for thrombocytopenia, treatment depends on its cause and how severe it is. If your thrombocytopenia is caused by an underlying condition or a medication, addressing that cause might cure it. For example, if you have heparin-induced thrombocytopenia, your doctor can prescribe a different blood thinning drug. Other treatments might involve blood or platelet transfusions. If your platelet level becomes too low, your doctor can replace lost blood with transfusions of packed red blood cells or platelets. Medications. If your condition is related to an immune system problem, your doctor might prescribe drugs to boost your platelet count. The first step drug might be a corticosteroid. If that doesn't work, stronger medication can be used to suppress your immune system. Surgery. If other treatments do not help, your doctor might recommend surgery to remove your spleen, that is known as splenectomy. Plasma exchange. Thrombotic thrombocytopenia purpura can result in a medical emergency that requires plasma exchange. Now I will tell you about some lifestyle and home remedies. If you have thrombocytopenia, try to avoid activities that could cause injury. Ask your doctor which activities are safe for you. Contact sports such as boxing, martial arts, and football carry a high risk of injury. Drink alcohol in moderation if at all. Alcohol slows the production of platelets in your body. Ask your doctor whether it is okay for you to drink alcohol. Use caution with over-the-counter medications. Over-the-counter pain medications such as aspirin and ibuprofen can prevent platelets from working properly. Well, this was my detailed video about low platelet count. I hope you like this video. If you have any questions about thrombocytopenia, please let me know and I will try to answer those questions as soon as possible. Thanks for watching this video. See you in next video. Bye for now.